Okay. Any other health professionals?
Shirley from Kai.
Good to see you. Thank you very much. I am Brooklyn Borough President Eric Adams, and we're really here to talk about the novel coronavirus and to really address some of the concerns that many of our residents are having in the area. And I want to thank our partners who are here, the Chinese American Planning Council. I want to thank them for hosting us today, as well as the New York City Department of Health and Mental Hygiene. Dr. Neil Vora is here as well. Winnie Greco, our liaison from my office, Community Board 7, Community Board 12, the elected officials who couldn't make it but who sent reps. We have a rep from Congresswoman Velasquez's office, as well as from Councilman Machaca's office, and as well as Karen, a good friend, who's here from Assemblymember Ortiz's office as well. We have a few healthcare professionals who are here, Dr. Chen and Dr. Dickman from Maimonides Hospital as well. So the reason I intentionally mention all of the names is because we want to show you this is a community-wide response, and we're doing a series of things. Number one, we are producing a flyer in several different languages, one in English, one in Chinese, and one in Spanish as well. So we're saying hello, ni hao, and buenas noches. We're doing it in all the different languages. The goal is information. There is a heightened sense of awareness, particularly around the holiday season when many people are traveling to and from China. So there's a concern, and we want to really just alleviate some of that concern. The best way to do it is to provide as much information as possible, and that's why we're partnering with our healthcare professionals to allow us to get the information out. And so we will be handing out these flyers in the area to give you very real, useful information. The best tool is soap. You know, use the soap and water to wash your hands, wash them well. This is the best tool to use, and it is something that we are encouraging people to wash their hands often. If you have to cough, instead of coughing in your hand, you could cough in your sleeve, and some simple tips that could assist in the prevention of the spreading of the novel coronavirus. And so by us giving you information, you don't have to live in fear and uncertainty. There's a lot of information on the internet that are saying so many different things, but the healthcare professionals here will respond to some of those issues. And we should note there has not been one case in New York State. As you look at the number of cases, roughly 4,500 plus cases that has taken place in other areas, but in New York State, we want to keep it that way, and the more that we do the right things, we can be successful in doing so. And so it is our goal today to just really give you the information, hear from the healthcare professionals, and provide a sense of calm and a sense of understanding that our healthcare professionals in the Department of Health and Mental Services is really doing what needs to be done to ensure that this virus does not spread throughout, particularly a community like Sunset Park. We believe this is the Beijing of America. We have a large Chinese population. Many people are coming home, returning to the city after visiting China, where you have a substantial number of cases in some province, and our goal is to continue to give you the tips. So frequently wash your hands with soap and water or an alcohol-based hand sanitizer. Use a tissue when you're sneezing, or like I said, sneeze into your arm, folding. Avoid being around people with cold or flu-like symptoms. Cook animal-based food thoroughly. avoid unprotected contact with wild or farm animals. So simple tips will go a long way. And we want to make sure we're going to continue to share those tips also in Chinese, and that is part of the tips that we have here as well. So I want to turn it over to Dr. Vora from the New York City Department of Health and Mental Hygiene. Doctor?
Thank you.
Thank you.
Thank you so much for the opportunity to be here today. Really appreciate the invitation. And this is a really good opportunity to spread accurate, important information for the community so that you all have the information you need so that you can protect yourselves. So that's my goal, just to tell you a little bit about this virus. So this new virus belongs to a group of viruses known as coronaviruses. And there's a variety of different coronaviruses. Some of them can infect people. And when they infect people, there's a range of different symptoms that they can cause. Sometimes they cause mild symptoms, such as cold-like symptoms or runny nose, but sometimes they can cause a more severe set of symptoms, including pneumonia. So this is a new coronavirus. It was discovered for the first time in December of last year, and it was found originally in a part of China. It has been spreading through parts of China and also other parts of the world. There are over 6,000 cases to date. And this new virus can cause symptoms including fever, cough, or shortness of breath. And there's a lot left to learn about this virus given that it's so new, but the important thing again is to have the information available for the community so that you all can take the steps you need to protect yourselves. And so generally we're recommending that people who have symptoms including fever, cough, shortness of breath, and when that illness started, if they've been in Wuhan, China within the 14 days prior to that, that they speak to their medical provider to get information on how to protect themselves. If a person is worried about infection with this virus because they were recently in a part of China where the virus is circulating and they have symptoms like I've mentioned, it's important that they call their provider before they go to the provider so that their provider can take the necessary steps to safely manage that individual and prevent other people from also getting sick. There's also some steps that regular New Yorkers can take to keep themselves as healthy as possible in the setting of the emergence of this virus. And the steps that people can take are actually very similar to what we would recommend anyways in a flu season like we are currently in. And those steps including washing hands with soap and water, avoiding touching a face, the person's own face without washing the hands before that, and also avoiding close contact with people who are sick. The good news is that there are no cases of this virus here in New York City. There's no evidence that we have the virus right now in New York City. So again, it's very important as we confront this outbreak to separate fiction from the facts. Because in social media and in the internet, sometimes there is the spread of misinformation. And this misinformation can also lead to stigmatization of groups of people, which is exactly what we want to avoid. Focusing on the facts is the important thing right now. So one thing to keep in mind is that the risk to New Yorkers right now is low, but our level of preparedness is high. And so there's no reason to avoid subways or restaurants at this time because there is no evidence that right now there's any transmission of this virus in New York City. Live your life as you normally would, but just stay aware of the updates because there's a lot left to learn about this virus given how new it is. And as the information comes out, we're going to be very forthcoming and make sure that people have the information they need to stay healthy and protect themselves. So again, I want to thank you all for your time today. Thank you again for the invitation to be here. Thanks.
Thank you. Thank you. Very informative. We also want to thank some of the community organizers, Steve from CPC, as well as Rosita Chan as well. Steve, you want to say a few words?
Sure.
Yes.
Good afternoon, everyone. My name is Steve May. I'm the director of CPC's Brooklyn Community Services. So I want to thank Borough President Adams for really hosting this event. Thank Karen from Assembly Member Ortiz's office, and of course Lisa from Councilman Menchaca's office, and some of our community leaders, community organizations, Shirley from Rosita from BCIA, and really the importance of this info session is to get again, separate the facts from the fictions. Like from us working in the Asian community, Chinese community, there is a lot of misinformation. And not to pick on WeChat, but for those of us that, again, work in the Chinese community, WeChat is like a very powerful social media tool where we get a lot of information. A lot of the information is inaccurate. I've had folks tell me like that there's there's an outbreak in New York City, or that there's 10, 20 cases of infected individuals in New York City, and that none of that is true. And sometimes, like, we're guilty of that, as like sometimes our staff talk as well, right? We hear different information, and we need to make sure we get the facts straight, that currently there are no infected cases, as we know, in New York City. And again, as Dr. Our medical professional telling us that live our life and continue to just be New Yorkers, right? Be out there and enjoy the Lunar New Year and really enjoy each other's company. And there's so many celebrations coming on because of Lunar New Year, and Lunar New Year goes on for roughly a month. And there's so many events. Enjoy them, enjoy the culture, enjoy the heritage. And again, it's like I'm not going to take too much of everyone's time, but just want to thank everyone for being here. Hopefully, we're able to get this information out to all community members. Thank you so much.
Anybody need to talk in Chinese, speak in Chinese, okay?
OK，大家好，很感谢我们布鲁克林区区长亚当斯来这边呢，带着我们，给我们做一些从社区的华人社区这边呢做一些教育我们怎么样预防这个病困，然后呢，希望我们呢能够通过这一次的教育，让更多的人来了解。这是我们布鲁克林区区长亚当斯要我用中文给大家宣传一下，谢谢。
Thank you. Okay, any of our medical professionals, would you like to add anything at all?
Sure.
Just introduce yourself.
Sure. Good afternoon. My name is Eitan Dickman. I'm a physician working at Maimonides Medical Center. I'm the medical director of the emergency department. I'm joined today by Dr. Samantha Chin, who's also one of the attendings at the Maimonides Emergency Department. I want to echo what the previous speakers have said, that to date there have been no cases of coronavirus here in New York City. We are vigilant and we are prepared. The emergency department has already put in place, and we have updated our protocols to screen patients who are potentially at risk for having coronavirus. Similarly, other areas of the hospital, including our outpatient clinics, have been updating their protocols and are ready to rapidly assess and evaluate patients who are at risk for having this virus. But as of now, it is important to separate the fact from the fiction. I would echo that to date, influenza is an issue, that patients should still be vaccinated if they haven't done so yet, and we have not seen any coronavirus in Brooklyn or in New York City.
Thank you. Okay, we're open to any questions. Again, I want to thank my colleagues in government that represent this office, Senator, Councilman Nchaka, Assemblyman Ortiz, Congresswoman Velasquez, for all coming together and making sure that we come together as a unit to deal with number one, the immediate concern, number two, to dispel any rumors, and number three, to get the information out. This is a very important time in the year for this community with the many holidays that are taking place. We don't want people to remain indoors, as the doctor stated, Dr. Vora stated, that we have no cases here in New York, and as I will continue to state, it starts with this: a bar of soap or liquid soap or alcohol-based product. Clean your hands, do it often and as much as possible, so to make sure that we want to keep it 0 cases in New York, and we can keep it at 0 if we all chip in together. Okay? Yes?
Maybe Dr. Borough or any of the doctors could address this. We've been focusing today about the run on masks. It's happening in a lot of communities in your city, including here in Brooklyn. Pharmacies are running out and sort of price gouging. I want to talk about the effectiveness of a regular surgical mask versus the N95 mask, which is obviously used in a clinical setting. What do people need to know? Because people are walking around with them and they feel, is it a false sense of protection? Is it worth doing because it can somewhat. Can you explain the value of the mask and its limitations?
Good question.
You're right that there are different types of covers that a person can put over their mouth and nose. There's some that are specifically designed to be used for example, in a healthcare setting, and those require special fit testing. Right now, the good news is that there's no evidence of community transmission of this coronavirus in New York City. So we do not have a recommendation that the general public is advised to be wearing masks. Of course, people have the right to if they choose to. So really the only time right now that we're recommending that people wear masks is if you fall in a certain occupational category for your work. For example, if you're a healthcare provider and you're seeing certain types of patients who might have certain illnesses. And also another category might be that if a healthcare provider is taking care of a patient, sometimes the healthcare provider will advise that particular patient to wear a mask. But again, we do not have any recommendation right now that the general public is advised to be wearing a mask.
But can you also talk about the effectiveness of a surgical mask when it comes to coronavirus? Because I know there's a lot of misinformation out there, and I think people really want to know, what they can do. And will a surgical mask protect them, or you really need that clinical medical grade mask that's fitted?
So the first thing I would say is that we're in the middle of a flu season right now, and another one of the speakers also mentioned this, that it's very important to get your flu vaccination, generally speaking, for most categories of people, and that can prevent a certain particular type of respiratory illness. Now, this new coronavirus, there's a lot left to learn about it. I mentioned before that there's a group of viruses known collectively as coronaviruses, and each of them has different properties in terms of when they infect an individual, the symptoms that can manifest in that individual, and also sometimes the transmission characteristics, so how those viruses pass from person to person are different. So with this new virus, it's very early to say what's the most effective type of mask to be using for this particular virus. So I can't particularly comment on that. But again, I would encourage everyone in the community to get your flu vaccine if you're in that appropriate category, and also to take other steps to keep healthy, such as washing your hands, avoiding people who are sick. If you yourself are sick, trying to stay home or away from work, staying away from school. If you're going to sneeze or cough, sneeze into a tissue or into your sleeve, for example, instead of on your hands. And these are ways that we can prevent ourselves from getting sick and also others from getting sick.
I think that's a great question you're asking, because part of the hysteria is around that, and we're going to reach out to the Department of Health and Mental Hygiene and see if there's some clear recommendations they have. As the doctor just stated, the precautions that we could take would be helpful, but I think that's the question that we're going to put out as well, and update our flyer to try to answer that question. That was a great question.
One more question?
Okay? Yes. Mm-hmm.
How's our hospital situation? Do we have surge capacity if indeed even people from Manhattan have to come in like happened during Sandy?
Yes. You want to touch that?
So we're very fortunate that we live in a city like New York City, where there's a very high level of preparedness. So the New York City Health Department works extensively with many partners across the city, including individual medical centers, with H&H, which is the health and hospitals, also with Fire Department of New York, the New York City Emergency Management. So there's many partners, including ones that I didn't mention, that we all work together to make sure that we have a coordinated response to any concerning calls about a patient who might be infected with this new virus. And there's also plans to make sure that patients can get moved to certain locations as capacity exists. And so these, again, are part of a coordinated discussion between New York City Health Department and partners, including the Fire Department of New York, plus others.
Okay, thank you very much. Thank you. Stack of flyers. Look at some flyers. Hand out.
Sarah, just one more.
Yes.
The airlines, I think British Airways is
Up there.
always pulling flights that are coming. They're pulling flights between the U.S. and China.
There are flyers out there.
And there's talk, maybe JFK and LaGuardia and JFK and Newark will stop accepting flights from China. Is that too much?
Greater minds than mine will make the determination. I know they're testing at airports, including JFK. I think the goal is to do everything that's possible to make sure that the virus does not has a foothold here in the city. We've done a great job in doing that. I think with our agencies, we need to continue to do so, but greater minds than mine must make the determination of how we're going to deal with the incoming airport traffic.
Do you also feel like the mayor that you don't have a case now, but it's inevitable? Do you anticipate a case?
I believe we can change that inevitability around if we get the information out, if we take the precaution, if we have our local partnerships that we're doing here. I think Brooklyn and what we're doing here in Brooklyn is a case study for other boroughs to use, that let's get on the ground and get the information out. We're going to hit and go to many of our senior centers, our adult daycare centers. We want to engage the Department of Education. And so we need to do as much as possible to, if it does hit the ground here, that we can limit the exposure. I think the doctors have clearly stated that we can do so much as everyday residents if we give people the information. And we're going to hit as many of our locales here and get the information out. We're gonna use WeChat and other social media methods to spread the information. The inevitability does not have to turn into it being inevitable that it's going to spread. That's our goal. Our goal is to empower everyday people to feel empowered and not disempowered. Thank you. Thank you. Thank you so much.